Hi, my name is Kayla Campbell and I'm a student nurse here at the University of South Alabama, and today I'm going to be showing you the injection sites for intramuscular and subcutaneous injections. Here's my ID, and I'll now scan the room. Okay, so I'm now going to position the camera and perform hand hygiene and apply gloves if I were about to touch a patient. So, as I said, I'm going to be doing subcutaneous and intramuscular injection sites. And so I'm going to begin with the intramuscular, and if I can have you turn this way. Okay, and we're going to start with the deltoid. And so we would start by finding the acromion process. Relax, you're good. Finding the acromion process, which is the pointy part of the shoulder, going 3 fingers down from that, and then finding the deltoid insertion, which is about right here. And then we would do a upside down triangle, and that triangle would be your injection site. The next intramuscular injection site would be the ventrogluteal area. And so I'm going to have you move your leg forward a little, or just like wiggle it so I can feel. Okay, and so I'm going to place my hand on your greater trochanter. You're good. And then, will you hold up your shirt? You can put your foot down. Okay, and then I'm going to point my thumb towards the groin area and put my index finger on the superior anterior iliac spine. And then I will point my second finger towards the iliac crest. And this V for ventrogluteal would be the injection site. I'd make sure and palpate it for good muscle, not feeling any bone, and adjust if needed. So now the last injection site for intramuscular injections would be the vastus lateralis, and that's right here on the leg. And again, I'm going to feel for that greater trochanter. Will you bring your leg back and forth again? Okay, so it's about right here. You do a hand's breath down from there and a hand's breath up from your knee, and you don't want to go past the midline on the top of the leg or the midline on the side of the leg. So it leaves you with a really nice, good rectangle for the injection. And for the intramuscular, you usually want to use the middle third of that rectangle. And so that is the last intramuscular injection site. So now I'm going to move on to the subcutaneous injection sites. And so I'm first going to start with the dorsolateral aspect of the upper arm. And so what we're going to do here is find the deltoid insertion and go 3 fingers down from it, and find the olecranium process or the elbow and go 3 fingers up from it. And that leaves you with this little rectangle right here, and you want to do it on not the full lateral aspect of the arm, but more towards the lateral rather than on the side of the arm. And so it'll leave you with that little rectangle. So the last injection site, which is also a subcutaneous injection site, would be the abdomen. And so for the abdomen, we would find the umbilicus and have a 2-inch diameter or border around it. And then we would make sure not to go past the intercostals or past the pubic region or past the superior anterior iliac spine on either side. And so that leaves you with a nice U for multiple injection sites. And that completes the injection site video.